Go, that's a good catch. Go, that was a good catch. Go, that's a good catch. That was a good catch.
And here we go again. Hello and welcome to another episode of Inside Lincoln Hospital, the heart of the Bronx. Today, well, we're going to be talking to Dr. Monique Collier. She's the Deputy Chief of Ambulatory Care at NYC Health and Hospitals at Lincoln. We'll discuss what drew her to a career in healthcare, deciding when is the right time to go to the emergency room versus urgent care, and all the latest updates at Lincoln Hospital. I'm the Dr. Bob Lee, and this program is brought to you by BronxNet's Media and Technology Studios in the South Bronx and NYC Health and Hospitals at Lincoln. Dr. Collier, thank you for joining us.
Thank you for having me, Dr. Lee.
Give us a little background on you.
Sure, absolutely. So I'm actually from a suburb of Philadelphia called Westchester, but I always dreamed of living in New York City since I was little. I had family here. I would always be excited to come see them when we came. So I was really trying to figure out how to get here. So after I graduated from college in Maryland, I took a job in management consulting, actually, here in New York City. So that was working for a while, but was not necessarily aligned with my passion for healthcare. So that drew me back to Rutgers Medical School in New Jersey. Yeah. But I had to come back to New York City.
What drew you back to New York City?
So residency at Columbia in pediatrics, and then fellowship for adolescent medicine at Montefiore. So I've been in the Bronx since 2007, North Bronx first, now at Lincoln since 2010, and really just been passionate about really uplifting and helping young adults and adolescents and children realize their full life potential and optimal health and wellness. So
I like that. Helping others get what they need out of life. I say it all the time.
Absolutely.
You're the Chief of Pediatrics and Adolescents Ambulatory Care practice. Can you explain what the ambulatory care part of it is?
Sure, absolutely. So ambulatory care, when you think of ambulatory care, you think of all of the care that you can receive in terms of your evaluation, diagnosis, and management of your medical issues in an outpatient setting. So this is a little bit different from being admitted to the hospital. That's an inpatient setting. Outpatient, we do everything the same day, and you can get the comprehensive care from that angle, as opposed to be admitted, which is usually more acute care. Yeah.
But, well, ambulatory care, it covers a lot. It's a variety of services.
It does. So at Lincoln, we have over 60 ambulatory care practices. That includes primary care practices, subspecialty practices, surgical practices. We also have about 8,000 surgeries a year. We see about 475,000 patients a year in ambulatory care. We definitely have a robust service that we provide.
You have a huge patient population.
We do. Yeah. We do.
And people want to come because they know the kind of work that you guys do at Lincoln.
Absolutely. I think that our community in particular here in the South Bronx, they know that they can get the services they need from Lincoln because we try to give them comprehensive services.
When do they go to the emergency room versus express care or urgent care?
Okay, that's actually a great question because it can get a bit confusing on to when to go where.
Yeah, so like, something happened to my child. Should I take it here or there, or
Absolutely.
What should I do? Because a lot of people go straight to the emergency room.
Absolutely. So I think that when you think about emergency room, you think of something that's sudden, something that's severe, life-threatening, and it can't wait. Those are reasons why you need to go to the emergency room. Think you're having a stroke, a heart attack, head trauma, any major body trauma, that has to go to the emergency room. When you think of things that need prompt attention, but they aren't life-threatening, that's when you can seek services in either express care or urgent care generally.
Can you get that type of service from express care? If nothing else is around and you see express care or?
In terms of the services for the...
Like if you feel like you're in trouble.
So if you feel like you're in trouble and you have something that's not, like I said, severe, sudden, or life-threatening, yes, urgent care or express care is the place to go. We can treat you for, minor cuts, scrapes, colds, sniffles, allergy symptoms. These things can be seen and evaluated and treated in express care in a very efficient and timely manner.
And those are some of the most common symptoms that the people get wrong when choosing between ER, express care, or urgent care.
Yes. So if you go to the ER with something like that, in terms of, you're having a bit of a cold, you're having a sniffle, you have a little bit of a rash, then because ER is a triage procedure where you're having a stroke and heart attack, you're going to be seen first. The scrapes, the rashes, the sniffle, you're going to be there a while, which is one of the reasons why we encourage such patients to come to express care, because they can be seen more efficiently and faster.
How do patients know when a fever is an emergency?
Okay, that's a great question. So I think one of the things to kind of think about when you have a fever, there's two things. So if it's an adult patient, as well as a pediatric patient, if you don't have a lot of accompanying symptoms, like you just have a fever for a couple days, you don't have any problems breathing, you don't have any stiff neck, you don't have anything, difficulty walking, anything from that standpoint, then the fever by itself could be seen in an urgent care. If you have a more complexity, then you might want to think about an ER.
So if you do have a stiff neck and a headache and fever and all of that, that says something else.
Yes, that's pointing to something that's more complicated than a simple fever. Yeah. It's more complex. It needs a little bit more investigation. It probably needs more immediate attention. So therefore, you want to go to the emergency room.
Yeah. What do people come to you mostly for in your practice?
So for me, because I am a pediatrician in adolescent medicine, I deal with a lot of patients that are coming for routine preventative care.
Yeah.
So they come to me because they need a school form. They need a check, they need vaccines. They need to be cleared for sports. Those are some of the things that I see people for routinely. But because I deal with an adolescent population, I also am doing a lot of mental health care, prevention, assessments, also contraception. If they're concerned about like sexually transmitted infections, these are all reasons that I see patients. Any menstrual disorders with female, young teenagers, those are all reasons to come to me.
You think more people have mental health issues today than ever before?
So I think that's a complex question. I think that we, particularly around the COVID pandemic, that particularly teenagers and children that weren't able to have their normal routines and get out and go to school, we definitely saw a bump in terms of mental health.
So that social interaction is so very, very, very important.
Absolutely. Yeah. So that was definitely a bump in mental health
Are they
issues.
still suffering from that today?
I think there's mental health challenges. I don't know that they're as severe as they were during the COVID pandemic. But what I do think is different about mental health than it was in the past is that we're doing a very good job of assessing it and recognizing it, as well as acknowledging it and treating it. Whereas before, in the past, it's been a bit of a stigma. Like you would never say, to your friend that I go to a therapist. You would never say, well, you might, but it wasn't it wasn't as commonplace as it is now that, I suffer from a little bit of depression or sad mood and I talk to my therapist or I want to get this taken care of. I think people in general are much more comfortable admitting that they're not always mentally okay.
Yeah, that's a biggie right there. What? You're seeing a psychiatrist? What?
Yeah.
But, if you need it, you got to go do it.
Absolutely.
Make it happen.
Absolutely.
So sexually transmitted diseases, is there a lot of that going on right about around this time? So
I think in particularly the statistics show that in this area of in terms of the Bronx is one of the higher prevalences of sexually transmitted infections sometimes. So that's one of the reasons why we want to just screen more routinely. So if you are a sexually active teenager, adult, you're going to come in and you'll get your either every year or twice a year test to make sure that you don't have any infections. And I think we do a great job of that and able to prevent it and prevent transmission. Yeah.
What advice would you give parents in dealing with their youngsters and trying to keep their family as safe and as healthy as possible?
So I would encourage parents to make sure that they have a good connection. Try to make sure they have a good communication and good connection with their children. It can be challenging at times, especially during adolescence. I have my own adolescents, and they don't want to talk to me sometimes. But sometimes got to talk about what they want to talk about.
Exactly.
To encourage a connection. I think that's a first step. I think second step is that utilize partnerships and resources. Have them come and see the physician as needed. So definitely on a yearly basis. But if you have concerns, don't hesitate to make an appointment with your pediatrician or their adolescent medicine doctor. Because I think that, a teamwork approach on all ends, from a parent perspective, from a physician perspective, from a educational teacher perspective, counselor, these are all ways to kind of pour into a child and teenagers. And sometimes, parents do that, and that's great when they utilize the teamwork. Sometimes parents are a little afraid, like, I don't know if I want to tell my, the doctor this is going on, or I don't want to tell the teacher. But that's what we're here for, I think that Lincoln in particular does an excellent job with community outreach and really just trying to meet people where they are, so that we want to, we all want to be well, and we all want to do well. So. And
that's what's going to take. People moving together in the same direction for a common cause.
Absolutely.
It's a family affair. God bless.
It is.
Blackstone.
Yeah. Recently.
Yeah.
Yeah.
Hey, listen, we're going to come back and talk some more.
Okay.
All right. It's time to take a quick break. When we return, we will continue our conversation with Dr. Monique Collier, Deputy Chief of Ambulatory Care at Lincoln Hospital. We'll be right back after this.
What's up, creative family? Discover your voice with BronxNet community media classes. Are you ready to bring your ideas to life? At BronxNet, we offer television production classes for community members ages 18 and over, empowering you to share your vision with the world. Get certified in field production, in-studio production, and our new exciting addition, podcast production. Once certified, you can create your own show to air on one of our 6 TV channels. It all starts with our free Unleash Your Ideas Masterclass, designed to help you plan your show idea and set you up for success on your production journey. This class is offered at the beginning of each month for your convenience. Our dedicated BronxNet team is here to support, encourage, and uplift you every step of the way. Join us and become a part of the creative force that engages and inspires the Bronx community and beyond. Sign up today and start your media journey with BronxNet. Visit bronxnet.org/education to learn more and register. Let's create something amazing together.
And welcome back. You're watching a new episode of Inside Lincoln Hospital, the heart of the Bronx, with Deputy Chief Ambulatory Care at Lincoln Hospital, Dr. Monique Collier. Thanks for hanging out with me.
Of course.
Thank you for letting me share in this space and time with you.
Of course. Thanks for having me.
All right. Doctor, you treat children, and I'm sure that parents, especially new parents, they have a lot of questions about this. What is your advice to parents about when they should take their child to the ER for a fever?
Sure. So when you think about when to go to the ER for a fever as a child, there's a couple things that you want to think about. One is like the severity of the fever, as well as and the symptoms, as well as the age of the child.
Yeah.
So if the age of the child is under 3 months, anything above 100.4 rectally or higher, 100.4 or higher, taken rectally, they should go to the emergency room.
Yeah.
This is a younger child, infant, that it's really hard to recognize if there is a severe bacterial infection. That's not something that you're going to really recognize based on just interacting with the infant. So they need to go to the ER to assess that.
Yeah.
It could be a little bit more dangerous also because they are so small, because the infection, if there is one, can go throughout their body, and you really want to get to the ER to evaluate that before that happens.
You know, a new parent, newborn baby.
Absolutely.
Any little thing that happens, you're like, ah.
Yes.
So yeah.
Scared.
And they're on high
Scary.
alert all the time. Yeah.
If it's an older child, you have a little bit more wiggle room. So the first thing I would do would be to advise, call your pediatrician. If you, they might recommend, based on the symptoms, that they be seen in the ER, or maybe that they be seen in express care or in urgent care, depending on their symptoms. If it's a simple fever with cold, cough, sniffles, without any difficulty breathing, without any difficulty with speech, or their drowsiness or loss of consciousness, things like that, they might advise you to go to either their office or express care. If it's something that is a little bit more concerning in terms of the symptoms, then emergency room.
Do you have children or friends with children that you consult with?
I actually do. I do. I have my own children that I actually try to stay away from taking care of, because I don't think I'm the most objective person when it comes to my own children.
Yeah, I would think that, since I'm a doctor, I can do this.
You know,
we don't have to go to the emergency room or ER, or that's the same thing. I mean, one of those.
I think it depends on I think it depends on the situation. I mean, I think there's things that I could recognize.
You don't have a cabinet full of stuff?
I mean, I do have Tylenol, Motrin, the typical things that I would advise patients to use at first. But if it's anything more severe, then I would have them evaluated by, a set of objective eyes, their pediatrician or somebody in express care, urgent care. I do, occasionally with sore throat, you need to go to urgent care or express care. I've been to a Lincoln in order to assess whether or not they have a strep throat.
Yeah. And people, if they know you're a doctor, the next door neighbor's going to come running over with their kids.
Yeah, they'll ask the questions. Right? They'll ask the questions. They'll send the screenshots of the rashes. And I'm like, I can't really tell.
All right. My child hit their head. ER or express care or urgent care?
Okay. So that, again, there's a little, it's never really a straight answer, as I think, as you can sense from my answers, is that basically it depends, again, on severity as well as the symptoms. Mm-hmm. So if you have hit your head and you have a loss of consciousness, you have difficulty walking, your behavior is off, you're drowsy, you have a change in your facial structure, anything like that, then that is more urgent. That's emergent and needs to go to the emergency room. Loss of consciousness, absolutely emergency room. Now, if you have little Johnny bumped into the wall and he has this goose egg bump on his forehead or the back of his head, something, and he's acting normally, he's still running around, then, that type of thing can be assessed in an urgent care or express care, because it's probably more simple and less complex related to other body systems.
Now, if he hits his head and wants to go to sleep, that's a different story, right? So
normally I advise parents to just really assess their child's behavior, which you can't do if they're asleep. So I would before I let him go to sleep, I would keep him up a bit, make him talk to you, maybe have him eat some, something small to see if he has any symptoms like vomiting or anything that's concerning.
Yeah, don't let them start playing games with you. I hit my head. I can't go to sleep. I got to stay up late. No, you go to sleep, buddy. What if my child has a deep abrasion or cut? Express care, urgent care, for stitches? Do they do stitches?
So we actually, in express care, because of the time that it's supposed to be express, and because of the time sometimes that's needed for stitches, sutures, and staples, we actually don't place them in express care. We actually encourage our patients to go to the emergency room for that. However, on the flip side, if you do actually have sutures in place, staples in place, you need wound checks to make sure the wound is healing appropriately, you need them removed, then you can get that performed in express care.
My child has a rash or allergic reaction. How do I know if it's an emergency?
So if your child's allergic reaction encompasses other systems, They're having problems breathing. They're having swelling. They're not able to talk to you. They're a bit, they're a bit white, like in their appearance. They're not getting adequate blood to different parts of their body. Those are concerning symptoms. Yeah. There's something severe that's called anaphylaxis, which is severe allergic reaction that encompasses multiple body systems, is accompanied by problems breathing. Those type of things absolutely have to go to the emergency room right away. If you've used an EpiPen, you need to go to the emergency room. However, if you have something like a rash from, going outside in poison ivy, or you have a rash that's limited to one area of the body, those type of things, or you have allergic symptoms that are coming from your nose or your mouth, just basically with the springtime allergies. Yeah. All of those things can be seen in Express Care because they're more localized, simpler, and less life-threatening.
Asthma is big in the South Bronx. We did a big story over by the market over there, and I think there's a school, and we were broadcasting, and everybody had one of those inhalers. It was, I said, well, everywhere you look, everybody had an inhaler, and it was right next to the smokestacks over there. I don't know if they still do that or still use that smokestack. I'm
not sure, but it's definitely unfortunate that a lot of children, as well as adults, in the South Bronx suffer from asthma because of some of the environmental factors. So unfortunately, we know the Bronx is in the heart of 95 and 87, two of the most major highways in the United States that cross and pour out lots of pollutants from the trucks that travel through it. Also, there's like a lot of bus depots and other things that are basically promoting environmental triggers.
The water treatment plant and a lot of things. So asthma is a major problem in the South Bronx. Express care, urgent care, emergency room.
So if you need what parents know as an urgent nebulized treatment, which comes sometimes if you have difficulty breathing, visible difficulty breathing, a patient is heaving their chest. That is visible problems with respiratory distress. That type of thing would go to the emergency room. Yeah. However, if you're having a bit of a cough, more spasmodic coughs, you need an inhaler replacement, you don't have your asthma medications that need to control your asthma, but not having active respiratory distress, all of those things can come to Express Care.
When does it come to a point where you have to intubate somebody or, have a machine to help them breathe?
So that is somebody that's in significant respiratory distress that cannot be alleviated with medications at the time. So there's a lot of interventions that are done. If somebody's having an active asthma attack that is associated with respiratory distress. However, if the medications and the intervention that the physician is implementing aren't working, then the worst thing you want is this person to stop breathing. So to prevent that from happening and prevent them from not getting air, if they stop breathing, you intubate them.
The machine will help breathe for you. But how long do you stay on that?
It depends. It's variable. That is actually more on the inpatient side and outside of my scope of expertise. But I know that, what's important is that we recognize the signs and symptoms of failing respiratory distress and that you intervene appropriately to prevent any issues, major issues.
Is there a rule of thumb to help people make a quick decision during a medical scare?
In terms of whether to go to the ER or Express Care?
Yeah.
So if you think of the three words in your mind, sudden, severe, can't wait, emergency room.
Got it.
If you think can wait it needs attention, but not right now. It's annoying symptom, but it's not life-threatening. Then these are all things that you could think about for Express Care. And if you make that decision and are going to Express Care, then you could save yourself a lot of time sometimes. You could be seen more efficiently, effectively. Yeah. And then also sometimes with different insurances, the copay is different. The ER copay is higher and the Express Care is usually lower.
What happens if someone goes to the wrong place? I know if you go to one place, they may send you somewhere. No, this is a little more severe. Let me send you to the ER, or vice versa.
So that
the ER won't send you down to a.
So the ER will never send you to Express Care. Yeah. But the ER, you're going to wait. So if you have a cut, if you have a sniffle, but I have somebody that comes in from a car accident, has trauma, I have a stroke, I have a heart attack.
That's first.
They're going first.
Yeah.
Your scrape, unfortunately, is going to wait.
Yeah.
So that's happening if you go to the ER and you could be seen in express care. Yeah. If you go to express care and you have issues that are severe, sudden, and life-threatening, then the express care is going to not be able to see you. They're going to have to transfer you to the ER. The beauty of Lincoln is that our express care is in the hospital, so we can get you to the emergency room quickly. However, if you're thinking about this, you know, I'm concerned about everybody, not just people that come to Lincoln. If you go to the City MD urgent care and you really need to be in the ER, you're basically delaying the time that you could be spent in your evaluation and management by being in the wrong place. Yeah. So I think it's important for people to kind of understand when to go where. And this is kind of a new thing. We didn't always have urgent care and express care. So I think it's important to educate our community.
Well, you're educating us right now. We've learned a whole lot from you, Doctor. You mentioned that Lincoln has the express care service. Why should patients choose Lincoln Hospital?
So I think one of the major reasons that our express care is wonderful is that we are within the hospital. So like I said, if you need to go to the emergency room, that is basically going down the hallway. If you need labs, if you need x-rays, we do that within our hospital so that you don't have to go somewhere else to do it. We also see everyone. We are not selective in regards to immigration status. We don't care. We don't care if you can't pay. We will see everybody and are welcoming to all of the community. We also have board certified doctors, nurses, patient care staff, as well as we can send your prescriptions where you need them. I think there's wonderful things about our express care, and I encourage everybody to visit it if they need to.
Doctor, you know, we're on TV, but on radio, we always give those shout outs. Would you like to shout anybody out? Any patients or people that work with you? Or
I would like to shout out our CEO.
Warm things up a little bit.
I would like to shout out our CEO, Ms. Contreras, for, you know, putting this together. Yeah. I would like to shout out my Department of Pediatrics, Dr. Shavalikana, as well as my colleagues within the department. Ambulatory Care, Dr. Fisher leads a wonderful department for that. Dr. Marshall, our CMO, you know, gets everybody in line in terms of the doctors. I think that our community is beautiful and great, and one of the reasons why I've wanted to stay at Lincoln for so long is because I love my patients, I love the community. We
can feel that, you know, right through this whole conversation. We can feel how warm and you know, pleasant you are.
I'm glad, and I think that it's just important for everybody to realize that you have the tools, you have the strength to do, you know, what you need. It's just that we just have to sometimes figure it out and utilize our resources.
Doctor, thank you so much. Big high five to you.
Thank you.
All right.
Thank you for having me.
Thank you so much. Doctor, I want to thank everybody for watching. And remember, you can always watch Inside Lincoln Hospital, the heart of the Bronx, anytime, anywhere on BronxNet.org and YouTube. And while you're there, well, be sure to follow BronxNet and Lincoln Hospital on social media to find out who will sit down or who's going to sit down with us next. From BronxNet's Media and Technology Studios in the serious boogie down Bronx. I'm like, we got to say it. I'm the Dr. Bob Lee from 107.5 WBLS along with Dr. Monique Collier. And I'll see you next time inside Lincoln, the heart of the Bronx. You can catch another day and another way right here as we continue to do this. We'll see you next time, right? Thank you all for tuning in and checking it all out. And thank you for letting us share in this space and time with you. Peace.
That's a good catch. Go. That was a good catch.